So before we get into the different morphological features of incisors, let's first look in general terms of the features of incisors. So what you probably see right here is created these sort of lines right here. And what they're supposed to represent is mamelons. And mamelons are just a feature that when the tooth erupts, you're going to see these three lobes. So they're right here basically. And typically incisors have four lobes to consider. Three from the mamelon and one from the cingulum. So just remember that it's 4 lobes in total. A question that might come up on any exam is, what are the functions of the incisor? So they have 3 basic functions. It's for mastication, or chewing, aesthetics, how they look, and phonetics. So phonetics is one of those things that your professor may or may not say, and it's just basically to help you with speech. Again, aesthetics is just to make sure you have support of your lip and you're maintaining the appearance. A last feature that it has, it also helps in the guidance of the mandible posteriorly during the final phase of closing. So when you're closing your mouth, it's going to kind of help in the guidance of your back teeth. Typically, as you can see, the shape of the crown is more like a rectangle. And most of the contacts are going to be around the incisal third. There are some exceptions that we'll get into, and it's good to know. So let's start with some of the general features. So the crown is typically it's going to be kind of a longer crown compared to the root. Now if we look at how this tooth is shaped, we see that it tapers as you're going down to the root. So a nice thing to know is that it is going to taper as it's going from the crown to the root, or the apex of the root. And the narrowest point of the crown is going to be the cervical third. So the cervical third, I'm exaggerating where it is. Cervical 1/3 is going to be the narrowest, while the widest is going to be the incisal 1/3. They're typically going to have a slight curve right here, but it depends on the tooth. So the mandibular centrals are going to be more squared, and we're going to get into that a little later. As I said, this is the cingulum, and you're typically going to have a lingual fossa right here. And you may see kind of a lingual fossa, or a lingual groove, I guess you can say groove, kind of forming along here sometimes, and it divides the distal and the mesial. Another thing to note is the root thickness. So this is kind of an exaggerated drawing if we look at these two. So if we compare the roots, so now we're looking at the mesial versus the distal. Sorry about that, I just realized I wrote the wrong thing there. This is the mesial versus the distal view. The width of the root with relationship to the mesial and distal versus from mesial view, the facial versus lingual, we can almost see that there is a significant size difference. On the mesial or distal view, the facial lingual thickness of the root is going to be greater than the mesial distal from the facial view or the lingual view. Basically, this says that if I'm looking straight at the tooth from your mouth, you're going to see that the root is smallest. Now, if I compare that same thing to looking at the side of the tooth, it's going to have the thickest root or the widest root. Another thing to note about if you're doing a tooth ID, when you're looking at the incisors, they typically have this wedge shape right here, so it kind of looks like a shovel. So keep in mind that if we're looking at incisors, it's probably going to be a shovel. Also in the tooth ID, when you're identifying this curve right here, that's going to help you tell or it's going to tell that this is the distal side. So it's going to be able to help you distinguish the right from left tooth, or right from left quadrant. Now if we look at the marginal ridges, unlike our posterior teeth, the marginal ridge is going to go from the incisal and make its way towards the cingulum. So it's going to kind of follow or be parallel to the tooth's long axis. And we're going to see in the posterior teeth this is slightly different. So I know this video is short. I'm trying to make the videos a little shorter so you get the points while not having to spend so much time. If you like the video, please hit the button below to say like. If you like the channel, please subscribe. And if you have any questions or have any comments regarding the video, please let me know, and I'll try and answer them as quick as I can. Thanks.